Yeah, the UIC session was about staging for cancer. So I was just giving a general introduction to the importance of staging, not just for the clinical care of patients, but also for monitoring cancer control programs. The idea of how at what stage of the disease are cancer patients being diagnosed. And then going on from that to the session was really concerned with how can we monitor that in low-income settings. It's a difficult thing to do. So we were talking partly about the tools that have come through the UICC staging group, the TNM group, to come up with a simplified version of TNM that's adaptable for cancer registries in low-income settings. And this is in the new UICC TNM book. So we were talking about that and how this might be implemented in the cancer registries in Africa. It's something called the essential TNM. It's exactly equivalent to the TNM, but a much simplified system that we feel that cancer registrars could abstract from the clinical record if the full TNM isn't there. That's the idea, and we're going to develop training programs to help them do that. The idea being that then we'll be able to get stage information on the great majority of cancer patients that we're registering, which we can't at the moment. It's not, the information isn't there. Well, the end game is then we'll have good information on the whole population in areas served by cancer registries, so we can monitor what stage of disease people are being diagnosed at. Then if we introduce screening programs, can we improve the stage at diagnosis? When we want to calculate survival for the population, we'll be able to calculate survival specific for each stage. That's why we want this information. So that's what that session was concerned with. Yeah, I mean, there's a lot of it's interesting, the roundtable discussions. It gave the audience a chance to give their experience about how difficult it was to get stage information on patients in Africa and who should be doing this. The clinicians should do it on every case. Well, they should, but in the reality, when you go to a case record, they might have done it, but they haven't committed themselves to paper, which we know very often happens. Clinicians will mentally stage a case, but they don't want to write it in case they've made a mistake or something. So all these issues came up in the discussion. It was very interesting. Yeah, I think so. And like I said, we already tried testing this UICC essential TNM system in Africa, and somebody presented the results of that. It went so-so, and we learnt a lot from it, that it's difficult for cancer registrars to be able to stage a case of cancer themselves based on what's in the record without some extra training. Okay, it seems a simple conclusion, but it really shows that they need a bit more practice in medical terminology and so on, and training to be able to read through a medical record to stage some cases. So we're going to work on that. We're starting with the IARC in Lyon. We're going to hold a training course in December to start on the process of developing training tools for doing that. That's most of it. There was also a presentation of this new pediatric staging system based on the Toronto guidelines by Dr. Gupta. That again is something that's a very welcome development. It's a simplified staging system for pediatric cancers that's feasible to use in low-income settings. So this is a really welcome development as well. So we're hoping also that some of our cancer registries that deal with children can test this system also over the next year.